Hello everyone, I'm Dr. Alvarez with Endobariatric.com, and thank you for being here for another episode. And today, as you can see, I'm here with a special guest. This is Sharon. She's a former patient of mine, and she got the opportunity to visit us again. And yesterday we were chatting. I asked Sharon if she would be willing to sit down here with you just to talk about her experience with weight loss procedure, on what has changed and what has it done for your life. So thank you, Sharon, for accepting the invitation, the invite, because I know you're helping a lot of people out there, maybe of course struggling with weight, but maybe just on the fence, should I take the leap? Shouldn't I? Should I go to Mexico? Is it safe to go to Mexico? And all these things that it crosses the patient's mind. So, Sharon, you want to tell us where you're from,
Sure.
what you do for a living?
Yes, I'm from Texas, Houston area, and I work at a hospital and a rehab facility. I'm an occupational therapy assistant.
Mm-hmm.
So healthcare is really big, and I see what a lot of people go through as they get older and the challenges they face, especially if they have weight problems.
Correct.
So, that kind of led me a little bit along this path, but I did have a friend that talked about it first, and when you talked about the safety of everything, she was trying to get her surgery approved in the States,
Mm-hmm.
and was having trouble. They kept giving her the runaround and making her do more things, and I remember I stopped by her office one day and said, "So what's going on?" And she said, "Oh, I'm going to Mexico to have surgery." And I had the same reaction that most people. I was like, "What? No." And she explained it to me, and by the end of the conversation, in probably 5 to 10 minutes, I said, "I may go with you," and I did.
Mm-hmm.
We came, her mom accompanied her, and my husband came with me. So
How long ago was that?
that was in February of last year, 2022.
So it's a little bit over a year
Yes.
that you had gastric sleeve surgery here at our center. And how did it go? How did surgery go?
It's been great. No pain. I had no pain at all afterwards. I have lost almost 100 pounds, and just my quality of life has been changed, just absolutely changed. I went from an overweight child to an overweight adult, grew up on Southern food. I grew up in Tennessee, and
Good food, by the way.
Good food, yeah. A little too much of it, obviously, but and I just feel like I'm a different person today. I've never felt as good as I do. And I just had my 60th birthday, so that says something about you're not too old to do it. So
Somebody today asked me that for going into the operating room, because I always stop by with my patients, ask them any personal questions, anything they want to ask before. And one of them said, "Well, I'm pre-menopause, and will it work for me?" I go, "Yes," as you just mentioned. Yes,
yeah.
It will. We've done our oldest patient at the age of 78.
wow.
At the time of surgery. It works.
Yeah.
It works because the calorie restriction is quite a bit, and it does work. So I was telling her that it will work for her, of course, because it's a great tool and powerful tool. So pretty much 100 pounds. That's a century. We call that the Century Club, right? Losing 100 pounds. Welcome to the Century Club. And
It's fun to shop for clothes now.
I can imagine, yes. I like to tell patients, it's not, the destination is great, being thin and healthy at the end of the road is what we're looking for. That's great. But the journey's fantastic.
It is.
So I tell patients, you enjoy the journey, enjoy every step of the way, and don't buy too much clothes because you'll be skipping sizes.
I've given away a ton of clothes, yes.
Yeah. So you've lost 100 pounds, pretty much, no complications, everything nice and good. And then I saw you back again.
Yes, you did, in June of last year. Yes, my husband came. He had never really considered the surgery, and I think he saw the success that I was having, and he was very overweight, as you remember. And he decided to come in June, and he has lost over 120 pounds. So he completely looks like a different person as well.
I saw the before and after that you have as a couple together. It is I know we have it on file. We probably can show it here. It's mind-blowing.
Yeah.
Mind-blowing. I mean, 100 pounds for you is amazing. Yes, men lose more.
He does.
Because men, well, he's tall. And,
Yes, and he actually had a goal that he set higher, and he surpassed that. He knew that he was going to get past it when he got close to it, though. And I said, I think you probably could go further than that, and he did.
He looks like a completely different man, and if you look at him right now, you would never think he had a weight issue.
No, not at all.
Yes, he looks absolutely amazing. And yes, men normally lose more or faster than women just because men have more muscle mass and the metabolism is a little bit faster than women, but doesn't mean women won't lose. I mean, the change in you is absolutely amazing. And of course, I can imagine his quality of life through the roof, right?
Totally different, yes. And one thing he mentioned that I thought was interesting, he said, everybody says, oh, how do you feel? I bet you feel so much better. And he said, you don't realize how bad you feel until you don't feel that way anymore and you're smaller. So he said, I didn't even realize that I felt bad until I lost all the weight and see how good I feel now. So we've joined a gym, we go work out. He walks 4 miles a day usually. He gets up in the morning very early and does that.
It's up here. He said.
He's good, yeah.
When I hear people say that, and it's changed up here, you've won.
Yeah.
You won for the rest of your life. You've won because you've had this second chance. You lost all the weight, and now you're doing something to keep it off, to maintain, and at that point, you have won.
Food choices totally different. We actually save a lot of money in grocery bills.
I can imagine.
Because you're not eating nearly as much, but we share a lot of food when we go out to eat. We look at nutritional values. We're always reading packages when we go shopping to make sure that we're getting the healthiest food and, decide on the proteins and what we're supposed to have first. So,
there's studies have shown that it is what you mentioned, Sharon, the saving on your wallet. How much time does it take for you to, whatever you paid up front for your surgery, to come back to your pocket by the amount of food you're saving?
Absolutely.
By not eating?
Yes.
And it is a matter, on average, a matter of 8 months with the amount of food you save and the money you save on that food. That amount of money that you paid for your surgery comes back to your pocket.
Yes.
And then that's not counting medications and hospital bills and medical bills and all these,
away,
yes, and et cetera, et cetera. So I'm really happy for you and your husband and the transformation that you've accomplished. And how cool to do this as a couple as well.
Yes, I think it's very good. There's just the support we give each other.
Yes, I mean, it's great. It's great. I mean, you did it at different times, very close, but different times. We get a lot of couples that do it at the same time, but he caught up to you. So it was fantastic because you have the support of each other and you push yourselves. Each other. It's like, let's go to the gym. Hey, I don't feel like working out. Hey, let's get going.
Just feel so accomplished when you're done, though.
Exactly. So I'm really, and now tell the audience why you're back again.
I'm back a third time because my sister decided to come. Yes. So I'm here as her companion this time.
Yeah. So we crafted her sleeve today, and she's recovering everything nice and good. So I want to thank you for accepting the invitation and helping the community out there that is struggling, that is just looking into this. Will the sleeve work? Will the sleeve be for me? How about, as you mentioned, going to Mexico? Is it safe? You've come 3 times now. And I thank you from the bottom of my heart, and I congratulate you and your husband on the transformation that you have achieved.
Well, we owe it to you. Thank you very much.
Thank you for the trust. I appreciate it.
Thank you.
Thank you very much.